Nurses who has to ask the famous sexual history question. What was the best answer you got? I worked in a prison and our sexual history question gets a little more in depth. However, my favorite answer of all time followed the question, have you ever used drugs or illicit substances? To which the inmate responded no, he had never. Then the sexual history question came up and he said, well, I snorted coke off a hooker, but I didn't duck her, so does that count? Apostrophe. We had to restart the questionnaire. I signed in a 16-year-old girl who told the doctor I can't be in labor. I've never had sex as she gives her dad a please don't kill me look. Family moments. This happened recently at my work. Teen girl presents with abdominal pain and swears up and down that there is no way for her to be pregnant. Doc orders tests, and as the lab is drawing blood, the mother asks the doc what he thinks it could be. The doc said, well, if she claims she couldn't be pregnant, she might have some kind of tumor or mass growing in her abdomen. I love that document. After lab results come back, it appears she is actually pregnant. Ultrasound is ordered and shows a baby that is well developed. Mom is ordered to leave the room and a vaginal exam confirms that her abdominal pain is definitely contractions from active labor. Patient is still saying that it's impossible. Doc orders mom from the room and goes in to tell her that no matter what she is trying to say, right now it's time to grow the duck up because you are going to be a mother in a few hours. 11 girls in 48 hours. Really? Apostrophe. No, I'm sad and lonely. Apostrophe. Part came in for difficulty with walking due to pain. When pressed, he admitted that he had someone forearm deep in him a week prior from a rough encounter. Sent him to a specialist. Turns out his pubic symphysis was inflamed and might have a stress fracture. Oddly, when results were given to him, he made it clear that it was worth it. Many years ago I had to accompany my grandma, RIP 2013, to a deposition/hearing. I can't remember what it exactly was. She was suing a grocery store because a shelf collapsed on her hand and broke her wrist. There was a big conference room table with her doctor there, attorneys, and other official people. Anyway, as they were going down the checklist of questions asking how this injury affected her life, the attorney asked, would you say that your sex life has been negatively affected? Apostrophe. Granny holds up her cast and says hell yes. Apostrophe. I was mortified. The room was humming with muffled giggles. As a med student in a standard clinic in Miami, I asked a lady how many sexual partners she had. Honey, I get paid to duck. I got no clue. She got all the antibiotics. When I was doing my housemanship a few years back, a girl told me she's a virgin. I was about to tell her about the fetus in her uterus. During my clinicals in school, I had an rotation. Now, I like the it's exciting and you see some really weird shit. I was baptized in the weird shit puddle by a 14-year-old chick who came in with abdominal pain. So my preceptor, this was early in clinicals, is doing his thing and asking medical history. When he asks her if she was sexually active, she says yes. Preceptor asks, last sexual encounter, thinking something was up. To which she responds, right before I came here. So, preceptor asks if she can describe the nature of her pain. She says yes. It's probably from the cucumber in my ass. Apostrophe. You ducking what? Turns out, she had a cucumber in her ass. Love that there's more than one cucumber story in this thread. My favorite was this young guy, maybe in his 20s. Comes in and on the form he circled the sexual history part, drew an arrow to the back. Then on the back it read it all began back in the 8th grade was to see. He continued on to fill half the page up with his sexual history. I'm pretty sure he did it only because he had to wait so long. When I was 13 I responded yes when the nurse asked me if I was sexually active. She then asked when was the last time I had sex, to which I uncomfortably answered that I have never had sex, and NBSP. I thought masturbation counted. When were you last sexually active? Apostrophe. Exhales loudly with raised eyebrows. That long. Huh. When was your last prostate exam? I don't have one. They removed it? No, I have a vagina. Oh. Op. I was a medical assistant working for a dermatology office. A 65-year-old man came in with an abundance of genital warts and said I kept sleeping with that same dirty woman. That's why I got these things. I was in active labor, pushing a tiny human being from my body, when a well-meaning medical student asked me if I had any history of sexual activity. Repost, my wife works in a hospital. She told me a story about a patient that presented with constipation, 3 days, and rectal pain. An examination found he had a rotting cucumber up his ass, which he claimed no knowledge of. Turns out he was not lying. He had recently returned from an extended trip away from home during which he had contracted a venereal disease, which he had passed along to his wife following his return. Rather than confront him with his misdeeds, his wife decided to go straight to retribution. So she drugged his dinner one night, then administered a coup de concombre, so to speak. Of all the possible visuals that come to mind when I think of this story, the one that I enjoy most is the wife at the store picking out the cucumber. Yeah, this is the one. Apostrophe. Army combat medic here. One guy came in with a very swollen eye that had been getting worse. As it turns out, the guy went to a fully nude strip club Saturday night and had a great time with the women there. So much fun that one stripper shoved her snatch in his eager face. The next day, his eye was puffy. By Monday morning sick call, it was so swollen he couldn't open his eye, and the erythema and edema was spreading over that half of his face. It was pretty jarring to look at. PA sent him for emergency surgery, and this is where I arrive at the point of this story. After draining his eye and flushing it, they looked for any particulate that could have caused the irritation, and they found a crab. Well, the stripper had crabs, so when she shoved dude's face into her vagina, some crabs took a journey into his eye and got stuck beneath his eyelid. It was this guy's first time going to a strip club too, but it sure as duck wasn't his last. TL. Dr. Stripper with crabs rubbed her vagina into patron's eager face and one got in his eye, which ducked his shit up. Not as funny as the rest, but I got a laugh out of hearing a young girl tell me she's not currently sexually active because the last time she had sex was the day before. During those questions, I had a nurse ask me. I answered yes. He then asked me what kind of birth control I use. I have an IUD, so I told him. His response was great. Is it? Installed? Apostrophe. Yeah. It's chillin' in my uterus. Not a nurse, but a former phlebotomist / health historian for the largest blood collection organization. One of donors was an older lady, maybe early 70s. There were 5 to 10 sexual history questions in a row. In the middle of them she blurts out, "Honey, I've been dried up 4 years. Nobody has been digging in this for a long time." Apostrophe. A woman came in with inflammation of the vulva, and when I asked about her sexual history, she said, "Do dildos count?" Apostrophe. My coworker is a very conservative Christian, only wears scrub skirts, doesn't cut her hair, etc. Close bracket. She at one point was taking care of a 60-something-year-old man who was in for an amputation or something. She was doing an assessment and asked about the significance of a certain tattoo. "Are you sure you want to know?" Apostrophe. Sure. Apostrophe. Turns out the dude was a trained and certified dominatrix, or whatever the male version is. Sorry, a little naive myself. He went on to explain the details and requirements of this training to my coworker for a good 4 to 5 minutes, stating finally that the tattoo was a trademark of some kind. My poor coworker walked out of the room with the most disturbed look on her face. Wouldn't give us any details, but it takes a fair amount to rattle a nurse. Ha. I worked in a medical call center and had to survey patients taking certain drugs. We asked if they were sexually active. Company was worried about libido inhibiting side effects. Best answer I heard was yes, but don't tell my spouse. Apostrophe. My grandma to another nurse, haven't had sex recently. The last man I was in bed with croaked right after. Apostrophe. Grandpa died from natural causes, my ass. Literally got roadhead on the way here. Similar. One of my classmates was asking a 75-year-old woman with dementia about her occupation for a PT exam. Her response: I give blowjobs in my garage to afford my sweet ride. Apostrophe. Sexual history. No, I'm more of a sexual folklore. Not a nurse, but the best response I've heard to this question was from a quiet guy in my freshman college English class. Somehow our discussion on vaccines led to this topic, and he told a story about his doctor asking if he was sexually active. His perfect response was, bro, I'm not even socially active. I'm a hospital corpsman, Navy medic, and I had this older retired salt dog as a patient a while ago. His wife had passed away, but I didn't know that. When I asked if we're sexually active, he said, well, no, for 2 reasons. I'm married, and she's dead. Not that that would change a thing, though. I felt terrible, and then he just started laughing and told me not to feel bad. Seriously caught me off guard though. Crusty old bastard. Took care of a post-op patient who had stuck dried kidney beans up his urethra because they felt good when they swelled up. Could usually pee them out, but this time they got stuck. Had to have them surgically removed. I've told similar versions of this story before. I was around 8 months pregnant and working as a nurse. I had a very round, beach ball-esque obviously pregnant belly going on. A woman came in with the chief complaint of lower abdominal pain that came in waves, and also reported experiencing a clear liquid discharge that she said felt like she peed her pants, but point blank denied being pregnant. She had a big sweatshirt and jacket on at first. She came back to me and changed into her gown with me in the room, and clearly she was visibly pregnant, and my immediate suspicion was that she was in labor. I point blank asked if she was pregnant, and she looked at me bewildered and stated she couldn't be because she hadn't had sex in over 6 months. I asked her when the last time she was sexually active, and she reported sometime in September, which was sometime around my own date of conception. Being that she's not grasping it yet, I point to her belly and then my own and say, how long has your belly looked like my belly? My hope is it would kind of be a look in the mirror wake up call. But it didn't work. She said she had just been feeling bloated over the last few months. She didn't believe she was pregnant until the ER resident did a bedside ultrasound to find the baby's heart rate. She was in labor and went upstairs to L&D. Oh, and she had her 10-year-old daughter with her. An anesthesiologist once asked me if there's a chance I could be pregnant. I snorted and said I wish. My surgeon cracked up. Navy hospital corpsman here. After my ship pulled into Cyprus for a 3-day Liberty port, I had a line about 10 people deep of sailors and marines in medical looking to see the document. The first 2 presented with the same discharge and swelling and stuff. Turned out to be a rather nasty clap/chlamydia combo, and when I dove deeper I found out they went to the same brothel. A little deeper, and found they even saw the same girl. So 4 people in. Same deal. When the next one walked in, all I asked, with raised eyebrows, Selena, supposed lady's name, and with a subtle and ashamed confirmatory nod they sat on the table ready for the dreaded ball punch. 5/9 people I treated that day went to the same lady. My doctor told me a story once, a bit off topic here but oh well. Back when they first started performing vasectomies, doctors had to call their patients back for standard follow-up questioning a number of weeks after the procedure. He told me he got the same answers from all of the couples he interviewed. Any sensation change? No. Any performance change? No. Etc. This went on and on, until one day, he asked a couple if there were anything different after the procedure. Any changes at all? The wife said yes. There is a huge difference since he had the surgery. My doc was very surprised, and when he inquired further the wife said, it tastes different. Oh, he said it was all he could do to keep from laughing as he made the note of seminal fluid tastes different after procedure. Sorry in advance for anyone who actually reads this. My wife is a nurse and once told me about a guy who had injected creek water into his penis with an insulin needle. He heard that injecting water into your penis makes it bigger and erections longer lasting. So while he and his girlfriend were camping, they decided to try it out with bacteria-filled creek water. Apparently it worked just fine for the first day, but after a couple days his penis started turning colors and swelling. My wife said that by the time she saw it at the hospital, it looked like an eggplant with weird, neon green pus coming out of the urethra. That's probably where they come up with the eggplant emoji. My friend answered his doctor once by just saying, "I go to an engineering school." Please click subscribe if you enjoyed this video.